Every article on the internet tells you to do kegels to last longer. But what if making those muscles tighter is the exact reason you are finishing too fast? Today, we are exposing the biggest myth in men's pelvic health. This video is for educational purposes only and is not a substitute for professional medical advice. Sudden changes in sexual function can be a sign of underlying neurological or cardiovascular conditions. Consult a urologist or healthcare provider. If you have been frustrated, confused, or quietly blaming yourself, I want you to hear this clearly. You are not broken. In many men, premature ejaculation is not simply a problem of insufficient strength. It is often a problem of poor coordination, excessive resting tension, and a nervous system that has learned to stay on high alert. Let us start with the standard advice that so many men have heard. Do kegels. The intention is not wrong. Pelvic floor muscles matter. They help support the pelvic organs and contribute to continence and function. But the problem is that pelvic floor dysfunction is not always a weakness problem. It can also be a hypertonicity problem, meaning the muscles are already overactive, over-recruited, or failing to relax and coordinate properly. That distinction changes everything, because if a muscle is already living at a high resting tone, then endless contraction drills may reinforce the very pattern you are trying to escape. For a man who is already tense, stressed, and bracing through the day, the real question is not, how do I make this stronger? The real question is, how do I teach it to let go? Think of the pelvic floor as a muscular sling that supports the base of the pelvis. In a calm state, it should have both the ability to contract and the ability to lengthen. That lengthening phase matters. Breathing and pelvic floor motion are coordinated, and when the diaphragm descends during inhalation, the pelvic floor should be able to respond and yield rather than remain locked in place. Now place that same system inside the modern male lifestyle. Long hours at a desk, shallow breathing, constant mental load, poor recovery, and chronic stress. Over time, the body can begin to behave as though it is always preparing for threat. The pelvic floor does not just work, it braces, it guards, it clenches. That is why some men do not need more contraction. They need a better strategy for downregulation. This is where the Kegel trap becomes so important. A trap is what happens when a good idea is applied to the wrong problem. Strength training is useful when a muscle is underperforming. It is not automatically useful when the issue is excess tone, poor relaxation, or poor coordination. In premature ejaculation, the evidence points to a multifactorial condition involving both psychological and biological factors, and pelvic floor rehabilitation has shown promise in some men. But that does not mean every man should keep squeezing harder. If your body is already living in a clenched state, then training more contraction can feel like tightening a spring that is already compressed. The spring becomes less forgiving, not more, and when arousal rises, there is less room for control. The most important shift in this entire conversation is this. Lasting longer is not only about force, it is also about release. A pelvic floor that can relax on command is more adaptable than one that only knows how to brace. That is why the next chapter matters so much. We are going to talk about the nervous system, the stress response, and why a man who feels pressure in his mind often feels pressure in his pelvis at the exact same time. So before you blame yourself, understand this. Your body may not need more tension. It may need a clearer signal of safety. The pelvic floor is not a vague concept. It is a real muscular system at the base of the pelvis that supports the bladder, urethra, prostate, anus, rectum, and contributes to continence and sexual function. When it is working well, it should be able to contract when needed and relax when needed. That balance matters, because a pelvic floor problem is not always a weakness problem. Sometimes it is a control problem, sometimes it is a relaxation problem, and sometimes it is both. So when a man says, "I feel tense all the time," that is not a meaningless complaint. It may reflect a pelvic floor that has stopped acting like a flexible support system and started acting like a constant brace. That is the beginning of hypertonicity, a state in which the muscles are too active, too guarded, or too unable to fully release. Now think about the modern male body. Hours at a desk, hips flexed, shoulders lifted, breath held high in the chest, stress from work, deadlines, finances, notifications, and mental overload. That pattern can encourage muscular guarding, including in the pelvic region. Clinical sources list prolonged sitting, abnormal posture, and stress, depression, and anxiety among factors associated with hypertonic pelvic floor symptoms. That means the issue is often not that the body is weak, it is that the body has learned to stay braced. It has been rehearsing tension so long that tension starts to feel normal. And once tension becomes normal, a man can mistake tight for controlled. Those are not the same thing. Here is the biomechanical problem with a hypertonic pelvic floor. A muscle that is already shortened and overactive has less room to respond. It is like a rubber band that has been held under tension for too long. The system becomes less adaptable, less elastic, less forgiving. In practical terms, that can contribute to difficulty starting or maintaining relaxation, pelvic discomfort, and sexual symptoms, including pain with erection or ejaculation. So when the internet says, just do more Kegels, that advice is incomplete for many men. Kegels are contraction exercises. They ask the pelvic floor to squeeze and lift. That can be helpful in some men, but clinical guidance also recognizes that a subset of men have a tight or overactive pelvic floor and are better served by relaxation-focused work first. This is why the coiled spring metaphor matters. If a spring is already tightly compressed, adding more compression does not improve control. It increases load. It reduces margin. And under arousal, that tight system can react too quickly. That is not a failure of character. It is a nervous system and muscle coordination problem. The body is trying to protect itself, but it is protecting itself too aggressively. There is also a reason pelvic floor rehabilitation keeps appearing in the literature on premature ejaculation. Clinical studies and reviews have explored pelvic floor rehabilitation as a treatment approach for lifelong premature ejaculation. And male health guidance notes that pelvic floor exercises can help some men, while relaxation guidance is more appropriate for those with an overactive pelvic floor. The key word is individualization. One size does not fit all. So let me say this as clearly as possible. If you feel chronically tight, guarded, or braced, the answer may not be more effort. It may be less force and more awareness, less squeezing and more lengthening, less performance and more regulation. The body has to relearn safety before it can relearn control. And that is exactly why the next chapter matters so much, because the pelvic floor does not live in isolation. It answers to the nervous system. The goal is not to fight the body. The goal is to teach it to soften. When that happens, the spring stops snapping so quickly, and the system becomes more responsive, more stable, and more predictable. The pelvic floor does not exist in isolation. It is part of a larger autonomic system that controls involuntary body functions, including arousal, vascular responses, and ejaculation. In male sexual function, parasympathetic activity is primarily linked with erection, while ejaculation is coordinated through sympathetic, parasympathetic, and somatic pathways. That means intimacy is not just a physical event, it is a neurophysiological event. So when a man feels his body shut down under pressure, that is not imagination. The nervous system is reading threat, and the body responds accordingly. The same system that governs heart rate, breathing, and stress responses is also involved in sexual control. When it shifts into high alert, pelvic relaxation becomes harder to access. This is why performance anxiety matters so much. In the literature on premature ejaculation, anxiety is repeatedly described as a relevant factor, and performance anxiety during intercourse has been associated with acquired premature ejaculation. In plain language, the more a man monitors himself, fears failure, or anticipates losing control, the more his body can move into a guarded state. That does not mean the problem is all in your head. It means the brain and body are linked. Worry increases arousal in the stress sense, not the calm, connected sense. The nervous system becomes louder, faster, and less flexible. And once that happens, the pelvic floor often follows the lead of the nervous system instead of acting with smooth coordination. Here is the key mechanism. Sympathetic activation is the branch of the autonomic nervous system that prepares the body for action. In sexual function, the sympathetic and parasympathetic systems must coordinate with precision. But when sympathetic tone is chronically elevated, the body is more likely to stay in a protective, compressed, readiness state. For a stressed man, that can feel like tension in the jaw, neck, abdomen, and pelvis all at once. The pelvis is not separate from that pattern. It is one of the places where the body stores the consequences of persistent bracing. In that state, the pelvic floor may clench faster and release more slowly, which can reduce the margin for control during arousal. This is the part men often miss. They try to force control at the exact moment their nervous system is already in overdrive. That is like trying to slow a car while the accelerator is still pressed to the floor. The solution is not more force, it is more regulation, more downshifting, more capacity to notice arousal without immediately reacting to it. The clinical goal is not to eliminate arousal. The goal is to stop the stress response from hijacking pelvic floor control. When sympathetic tone is high, breathing becomes shallow, the abdomen tightens, and the pelvic floor often joins the pattern. When you teach the body to settle, the pelvic floor has a chance to stop guarding so aggressively. So the lesson is simple, but it is not trivial. Premature ejaculation is not just about timing, it is about regulation. When performance anxiety rises, sympathetic tone rises. When sympathetic tone rises, the pelvic floor tends to brace. And when the pelvic floor braces, control becomes harder to maintain. That is why the next chapter is so important, because once you understand the nervous system, The solution stops being about squeezing harder and starts being about teaching the body how to relax on command. The first step in solving a hypertonic pelvic floor is not more force, it is down training. That means teaching the body to reduce baseline tension, restore coordination, and lengthen instead of constantly brace. In pelvic rehabilitation, relaxation techniques and diaphragmatic breathing are standard components of care because the goal is not only stronger muscles, but better muscle behavior. What many people call a reverse Kegel is best understood as a coordinated release pattern. Inhale, let the abdomen expand, soften the lower ribs, and allow the pelvic floor to yield downward rather than clamp upward. This is not about pushing aggressively, it is about creating space. It is about teaching the nervous system that it does not need to guard every second of the day. Here is the breathing pattern that changes the entire system. Slow nasal inhalation, quiet shoulders, expanding lower ribs, and a soft belly that moves outward without strain. On the exhale, the body should not collapse into effort. It should recover. Diaphragmatic breathing is used to improve relaxation, reduce heart rate, reduce blood pressure, and decrease the work of breathing. In pelvic health care, it is one of the simplest ways to help the body move from high alert toward regulation. There is also a practical reason this works. The diaphragm and pelvic floor are mechanically connected through the pressure system of the trunk. When breathing is shallow and upper chest dominant, the body often stays organized around tension. When breathing becomes slower and more diaphragmatic, the system gets a clearer signal to relax. That is why breathing drills are not a nice extra. They are a core tool for down-regulating the pelvic floor. This is also the point where I want you to think strategically rather than emotionally. If you have been told to do contraction drills, but you are actually living with a tight, guarded, overactive pelvic floor, then the smarter first move may be relaxation and coordination work before aggressive strengthening. Clinical pelvic health services and reviews describe pelvic floor rehabilitation as including posture work, myofascial release, biofeedback, and relaxation-based strategies. And in men with premature ejaculation, pelvic floor rehabilitation has shown promising results in studies, including improvements in ejaculatory control. So the sequence matters. First, soften the system. Then, if appropriate, rebuild control with a clinician-guided plan. That is how you stop fighting your own body and start retraining it. The body cannot always learn control through effort alone. Sometimes it learns control through safety, repetition, and release. Always rule out cardiovascular issues with a doctor, especially if this is new, worsening, or paired with reduced erection quality, chest symptoms, or other changes in health. Erectile dysfunction can be associated with cardiovascular disease, hypertension, diabetes, and neurologic conditions, and it is increasingly recognized as an opportunity to discuss broader cardiovascular risk. Sudden or changing sexual function is not something to dismiss when the pattern changes. That is also why I do not want you relying on a single drill or a single supplement. A pelvic floor strategy works best when it sits inside a broader plan. Better breathing, less chronic sitting tension, better stress regulation, and appropriate medical screening. Any adjunct you use should support the plan, not replace it. Now, on the subject of smooth muscle support, some men and their clinicians consider nitric oxide supportive strategies as an adjunct. Because nitric oxide is a central messenger in smooth muscle relaxation and erectile physiology. That is the biological rationale behind support protocols in this category. But the key word is adjunct. It does not replace breathing retraining, pelvic floor down training, or medical evaluation. So if you have been thinking, I need more control, I want to reframe that. You may need more release, more space, more calm. The reverse Kegel is not a trick, it is a signal. It tells the body, stand down, lengthen, and recover. And that is the foundation for lasting longer with less panic and less force. This video is for educational purposes only and is not a substitute for professional medical advice. Sudden changes in sexual function can be a sign of underlying neurological or cardiovascular conditions. Consult a urologist or healthcare provider. Here is the final reframe. Stop treating intimacy like a physical workout. For many men, the issue is not a lack of effort, it is a lack of regulation. Pelvic floor rehabilitation, breathing retraining, and coordinated relaxation are all part of the broader clinical conversation around male sexual function. And in some studies, pelvic floor rehabilitation has shown promising results for premature ejaculation. So the goal is not to force your body into submission. The goal is to teach it to feel safe enough to respond normally. Drop the tension, lengthen the muscle, reduce the guard. That is where real control begins. And remember, premature ejaculation is not a moral failing. It is a treatable condition with behavioral, psychological, and physical dimensions. Clinical sources describe behavioral techniques, counseling, medication options, and pelvic floor interventions as part of the treatment landscape. That means improvement is possible, and it does not require you to shame yourself into change. Your job is not to be harder on yourself. Your job is to become more aware, more consistent, and more strategic. The men who improve most are usually the men who stop fighting their physiology and start retraining it. If you have noticed erection changes, reduced morning erections, new pelvic pain, urinary symptoms, or a sudden shift in sexual function, do not assume it is only stress. Erectile dysfunction can be associated with cardiovascular disease, diabetes, and neurologic conditions, and it deserves proper assessment when the pattern changes. That is why the smartest path is a complete one. Medical screening when needed, pelvic floor down training, slower breathing, less chronic bracing, and a sustainable plan that fits your body instead of punishing it. If you are considering any nitric oxide supportive smooth muscle adjunct, it should be viewed as part of a broader care plan, because nitric oxide is a key mediator of smooth muscle relaxation in erectile physiology. So let this land. Confidence is not built by clenching harder. It is built by learning to regulate your body under pressure. That is the real reverse Kegel secret. Not force, not panic, not overcorrection, regulation, release, coordination, and then, when appropriate, rebuilding strength with the right clinical guidance. The body that can relax is the body that can adapt, and the body that can adapt is the body that can last longer with more confidence and less fear. Check the link in the description for the Smooth Muscle Support Blueprint, and keep this final note in mind. This video is for educational purposes only and is not a substitute for professional medical advice. Sudden changes in sexual function can be a sign of underlying neurological or cardiovascular conditions. Consult a urologist or healthcare provider. You do not need more shame. You need a better map.